So, thank you very much for the invitation. I would like to give you the last company perspective. And, well, I think for doing so, on the one hand, it is reasonable to give you an introduction, very short, one slide, promise only. And then I would like to show you the example on which I would like to elaborate in my talk. So, as promised, who's Brain Products? Brain Products is a company, a leading manufacturer of hardware and software solutions for neurophysiological research, plus question mark. And I think you will understand the question mark after the talk. It offers versatile EEG equipment to provide end-to-end solutions for laboratory use, for mobile use. We work on comprehensive solutions that combines EEG with fMRI, so-called concurrent EEG fMRI. Other functional imaging methods like FNIRS, like brain stimulation, TMS, electrical stimulation, as we already heard this morning, eye tracking, virtual reality headsets, everything that makes sense in combination with EEG. In addition to this, not mentioned here, of course, also electrodes, caps, everything that is needed to do the measurement. The company was founded in 1997. It's a medium-sized company and located in Gilching, close by Munich. So that's all I want to background I want to give you about the company. So the example that I mentioned, I would like to work on or elaborate on, is a neurometrics headset. So what is that, and where does it come from? It comes from an EU-funded project. The project was called MindTooth, and it is a device intended to measure neurometrics. As usual, you see several partners: Brain Science from Italy, Brain Products, ITCL, Spanish company, Aero in Italy, and also IBM Research in Israel. And the goal was basically to design a wearable device to measure neurometrics. So, Thorsten already mentioned one example of neurometrics. So mental workload is something that quantifies the mental effort required to do a specific task. I think we all have a kind of intuitive understanding of what it means. I think you all know what stress means, but we are measuring acute stress in contrast to chronic stress. So we are more interested in the acute part and vigilance. And I think also vigilance, state of being watchful, alert, attentive. I think you all have an intuitive understanding of what these measures in fact mean. We want to measure these metrics based on EEG. And because of this, we can take advantage of the rather high temporal resolution of EEG compared to other methods. So we do not want to aim for real time, but online. So maybe with 1-2 second delay. So what came out of the project? First of all, on the hardware side, an easy-to-apply headset, a light-weighted 8-channel headset, easy and quick to apply and calibrate, and also optimized in terms of electrode locations for these neurometrics. On the software side, we did two different things. One, a traditional, let's call it parameter-based method to determine the neurometrics, and alternatively, in addition, an AI-based method, machine learning, random forest approach. I do not want to go into these details because this is not the focus of my talk. But for those who are interested, I can tell you, well, the AI-based method works better. This is probably what you have expected, and in fact, this is what you see. So, what is the output? Well, basically, you get the time course of these neurometrics. So you see the swim lanes here with the workload, the stress, the vigilance, and basically you can label the time course here, of course, with triggers and events. So on task, for example, you can say in this moment the participant got a task, and then you can see how the workload, the stress, and the vigilance evolved after this task. We had 3 use cases in the project. The first use case was in aviation. So basically, we put everything into the flight simulator. And during the project, I also learned that pilots typically have to undergo annual capability checks, basically. So the annual training sessions were used there. It was nothing special. It was regular trainings pilots anyway had to undergo. And the ultimate goal is, of course, reducing the risk of accidents. Sounds reasonable somehow. The second use case was, in fact, very similar. When you do this with planes, of course, you can also do it with car simulators, or truck simulators, or ship simulators. I don't know, anything you want. The goal here is, of course, very similar. Reducing the risk of accidents. For example, for beginners, but also, for example, for senior drivers. And you may know in the EU, there is again an initiative which says people as of 70 in the future may have to undergo annual or biannual, I'm not sure anymore, checks if their driving capabilities are still high enough. So potentially in the future, they might not have to do it outside. Maybe it will be sufficient to do it there, because we can measure pretty precisely. The third one was the working environment. Of course, there can be very different working environments. So you can have light industry, heavy industry. So we had rather simple tasks in light working environments. And the goal here, of course, is reducing the risk of mistakes and increase efficiency and effectiveness. So I do not want to elaborate more on the product. But now the potential problems to the market, which from the company side means, should we bring it to the market or not? And this is, of course, a question that each and every company has to decide on its own. I'm sure many of you are aware of the fact that similar devices are already on the market. So we could say, well, the devices or this kind of device are already on the market. Well, maybe ours is better, but in principle, they are already in the market. So where's the problem? Well, I think the presented neurometrics headset is really one that is not really one of the most dangerous devices you have seen here during the last 2 days. So it is non-invasive, it is read-only, so it is unidirectional. It has no stimulation, it has no modulation, if you take it as it is. Of course, you combine it with a stimulator, then you can get a closed loop set up again. But the device as it is, I would say, is not really very dangerous. Nevertheless, even, and that's the point I want to make, even with such a rather simple device, in principle, you're already in the dual-use dilemma. Neurometrics can be used for the good and can be used for the bad, obviously. For the good, well, maybe improve efficiency, maybe work on strategies for stress resilience, maybe increase safety for pilots, you see in air traffic controllers, car, truck drivers, machine workers, enhanced learning, I don't know, many different possibilities. On the other side, well, possible misuse of neurometrics. Of course, this is neural data. And they may be used to monitor and supervise people. People may not know which data are acquired and which conclusions are drawn. I think this is one of the key points. If people do not know what conclusions are drawn from data taken from them, that's critical. So, yes. There is another consequence coming out of this dual-use scenario. The dual-use problem typically also brings up the problem of conflicting stakeholder interests. What does it mean? So, just as an example, I took the participant, one of the important stakeholders, the employer, and the public. And take these 3 examples, aviation. The participant may be the pilot. The employer may be the airline. The public, well, of course, air traffic today is not a local issue. If the plane which comes, let me check this. I hope you can you hear me again? Okay, sorry, great. So if the plane comes from Germany and crashes in Australia, well, it's obviously not only a local problem of Germany. So, and because planes go everywhere, it is the public here is a global. So on the automotive side, well, it's the driver. If it's a private car, there may not be an employer. If it's a company car, there may be the employer. Public, well, a car crash is usually not that severe as a plane crash, but somehow the public is also involved. On the worker side, yeah, the employer is obviously there. The public, well, typically the consequences are not so severe, but well, if it's a big accident and you have pollution in the whole city, then well, somehow the public again is somehow involved. So what you see here is you can have pretty conflicting interests between the stakeholders. This is typically different from what you see on the medical side. On the medical side, the patient and the doctor, they want the same, right? So the patient wants treatment, diagnosis, and the doctor wants to do the same. Here, we have potential conflicting interests because the participant, the employer, the public, etc., their interests may diverge. So the problem of conflicting interests is dangerous for companies. Why? Yeah, well, because the success is unclear. Because you do not know yet whose interest will win. Will the interest of the participant win in the end? Of the employer, of the public? That's difficult. You don't know. This is quite different from classical medical markets. Well, it's at least unclear until reliable consensus has been reached. Then the next potential problem is the, let me call it, international challenge. Well, of course, the EU is now well known for the GDPR, the Cyber Resilience Act, which will come soon. It's well known for the MDR now, etc., etc. But China, and that's what we heard yesterday, is a massive market. I think this is a fact. We have to accept it. And to be honest, many concerns are not shared in the same way in different markets. Because we have different values. I think in the end, it comes down to different values. And I do not want to say, well, the European or the English or the US are right, that China is wrong, etc. That's not the point. But the problem of inhomogeneous global markets make it difficult to successfully market products. Legal uncertainties. Legal uncertainties, I just put the quote here of who said, or who wrote basically, the development of neurotechnology has vastly outpaced countries and international organizations' attempt to regulate it. I think the statement is true. However, I wouldn't say this is specific to neurotechnology. When you have emerging, quickly progressing technology, this is the normal case. This is nothing special. But for a company, it is very important to know which mandatory regulations apply or will apply to the devices that a company wants to bring to the market. And if this is unclear, well, that's not an easy situation. I think we will have to have regulation. On the other hand, if we go into over-regulation, this is typically also a serious problem. And over-regulation, well, I don't know why MDR comes into my mind, but yeah, that might be a good example. Especially in the early phase, and here I want to make the case as Patrick did, especially in the early research phase of technology, too many regulatory burdens are counterproductive for efficient progress. You may put it in the category EU falling behind, or I don't know, but it's an issue. So the company perspective somehow is all emerging disruptive technologies like AI, like neurotechnology, raise fears, objections. I think that's what we already found yesterday. And ethical, legal, and societal challenges. Nevertheless, I vote for non-medical neurotech devices because potential misuse of a device should not prevent us from the reasonable use of a device. So I do not like the approach problem first. I like the approach benefit first, and then let's work on the ideas how we can limit, how we can prevent and avoid possible misuses, and not the other way around. So, in order to prevent avoid possible misuses, I vote for regulations. We will have to have some, as long as they do not overregulate. But we also need transparency, we need the consent, we need maybe to educate, inform, and train people. And when we do this, there is at least hope that we get acceptance for the technology. Maybe not trust. This is maybe too much and we cannot achieve that. But acceptance would already be a lot. Last but not least, I would like to emphasize the role of the main stakeholders in this game. So, of course, there are the companies, the providers of the technology. They can and must contribute their part to fulfill requirements. Technical requirements, they have to make sure the devices are safe, they have to make sure devices comply with regulations, etc. However, we should not lose the user and the application out of our focus. Why? The user is the key to reach, in the example here I'm presenting, to reach the consent between the participant and the principal. So maybe the employer, the neuromarketing agency, whoever triggers this investigation. So the key, the user is one key stakeholder. On the application field, you see such a device has a really diverse field of applications. You can use it in research, you can use it in health medical, you can use it in industry, you may use it in commercial, and just take neuromarketing as an prominent example for this. Maybe also for consumer. There is something called neurogaming. So some people may want to use it there. And never forget military applications. They are kind of always there. So what I want to say is, what are kind of guardrails we are going to implement? They have to address the provider, the user, and the application field. Otherwise, I think we will fail. And the potential application fields, as you can see here, are really quite diverse. Therefore, one set of regulations will probably not be adequate for this situation. Because healthcare is really so different from consumer and military and research, so it will not be a one-fits-all regulation. Okay. Thank you very much for your attention.